Well, good afternoon, everybody, and forgive a little bit of the delay. We're trying out some new technology today. I'm back in my home office, back into a 10-day quarantine period. But I wanted to update all of you on where we are in state and what we are looking at over the course of the next number of days and weeks. We continue to see record-breaking ICU capacity, hospitals that are getting filled up, a surge that we are experiencing, not dissimilar to other parts of the country, but putting real challenges on our staffing here in the state. You can see from this slide the staff that we have currently deployed. These are state staff specifically to now 75 facilities in 24 counties. You can see the kind of staff that we are utilizing, our health corps staff, the California National Guard, as well as contract staff and our CalMat teams, very familiar. Any of you have tuned into these presentations over the course of the last number of months, and working with Health and Human Services at the federal level, these DMAT teams, and I'll talk more about DMAT and some of the requests we have in with the federal government in just a brief second. As it relates to the federal requests, specifically around DOD staffing as well as that DMAT staffing, one of the things we're trying to do is extend the DMAT staffing that we currently are enjoying down in Imperial County. They're due to redeploy elsewhere in the middle of this week. I had a very good call with the Vice President. I want to thank the Vice President for his responsiveness for reaching out to get those DMAT support, or rather get that DMAT staffing and support extended through January. We're just waiting for the final determination on that, but it looks very, very favorable. We also talked more detail about these Department of Defense teams. We have specific asks out for 10 teams of 20. We are currently able to identify 75 personnel that will be deployed, currently have not, but are about to be deployed to critical sites here in the state. We're also working with HHS. We talked yesterday with a number of representatives from HHS about this monoclonal antibody strategy, and they're going to be providing some resources to do some infusions, what they refer to as their infusion teams. And that also will be deployed over the course of the next number of days. As it relates to what we currently are doing in alternative care sites, the alternative care sites are pre-identified. We have 11 of them all up and down the state of California. I mentioned on Friday the warm status on a number of sites that are not on this screen, though the 4 sites that are up on the screen are not only in warm status, they're now in active status. The others in warm status, these specifically in active status. We now have 62 patients in these alternative care sites. On Saturday, I was out there at the Sleep Train Arena in Sacramento. They had 17 patients on Saturday. They have 16 COVID positive patients today. Not all of the patients, those 62, are COVID positives. The ones at the Sleep Train Arena are, but you get a sense. Imperial Valley College, the Porterville and the Fairview sites, these are sites that are currently have been activated, and we will provide more staffing. As we provide more staffing, we'll allow for more patients to make their way in to these critical facilities. 37,892 is the last reporting period, total number of cases, tracking slightly below the 43,901 average number of daily positive cases that we have experienced over the last 7-day period. Now, some have inquired over the course of this weekend, the last number of days, suggesting or at least inquiring as relates to what they perceive based upon the data that's come in the last 4 days, that we may be seeing a modest, very modest decrease in the growth rate, total case growth rate. Still too early to tell, and I caution people not to read in again to weekend numbers, but we'll take a close look at this in the next few days, and of course make that data always would make it available, but to give you our assessment, professional assessment. Dr. Galley will talk in a moment. He can give you a side of that as well to see if he thinks that is indeed the case. Still too early to tell, but nonetheless, good to see the number the last 24 hours tracking a little bit below that 7-day. Let's take a look at the 7-day testing average, a little over, or rather just shy, I should say, of 330,000 tests. By the way, yesterday we reported over 395,000 tests, so close to 400,000 tests in the last reporting period. But you take a look over a 7-day average, roughly 330,000 tests. Want to still see that test number increase. We're starting to see those numbers increase, which is encouraging news. You get a sense of course, the positivity rate now in the state, 12% positivity. That's over a 14-day band. Let's take a look as we get to this next slide, where we were just 14 days ago, though. That 12%, we were at 8.7% just 14 days ago. So you see that rate of growth, that trajectory growing rather acutely. Hospitalizations, not surprisingly, 63% increase over a 14-day period. You're seeing that same trend line, 17,190 individuals hospitalized that are identified as COVID positive currently in our hospital system. The ICUs tracking with 3,644 patients now in the ICUs, a 51% increase in admissions as well over a 14-day period. The death rate is climbing as well. Sober reminder of how deadly this disease is and how tragic the loss of every life is, but particularly those lives that are lost during the holiday seasons with loved ones and family members torn asunder because they don't have their loved ones at home or even the ability to call. And so I just remind people of this fundamental point, and that is this disease remains deadly. And just take a look at the lives that have been lost just over a 14-day period, 2,741 people no longer with us, just over a 14-day period, an average now of 233 lives lost on average every day over the last 7 days. Again, those weekend reporting periods often lag. The 83, though extraordinarily high, I know looks to be more modest compared to the average, but that often is misleading on a Monday. And the reporting period's really the average daily rates that we should be very, very mindful of. 233 lives lost over that period. Here's a chart that more and more people are getting familiar with, and that's the regions in the state that are in a scarcity frame, now in a surge frame as it relates to ICU capacity. 2.5% is the statewide ICU capacity. That's in the aggregate. I always say this, and forgive me for saying it yet again, none of us live in the aggregate. So that's nice to see. 2.5% is low a number as that may appear to be. Doesn't mean much if you don't live in a region that is also detailed and exampled here. And that's why we include not just the state number, which could be misleading, but if you're in the Bay Area, 13.7% ICU capacity, Greater Sacramento region, 16.2%, northern part of the state, the northern regions of the state, a little higher at 28.7%, but you can see the real hotspots right now. San Joaquin Valley is 0%, and in Southern California, the most populous part of our state, at 0%, now in the surge phase of the ICU planning. So again, just because it's at 0 doesn't mean there's no ICU available. It means we're now in the surge plan. 20% plus or minus is the surge capacity pursuant to the plans that we have socialized and are now being utilized and advanced in those critical regions here in our state. Take a look at the regional stay-at-home map. 98% now of the population in the state represented in the update. San Joaquin Valley, Southern California, Greater Sacramento, and Bay Area. Again, it's just the northern part of the state that's not in that stay-at-home. You can see as it relates to the stay-at-home that we are likely, I think it's pretty self-evident, going to need to extend those original dates. You may recall that the expiration in San Joaquin County was on the 28th of this month, in Southern California the 30th of this month. Based upon all the data and based upon all these trend lines, it's very likely, based on those current trends, that we'll need to extend that stay-at-home order. You recall it was a 3-week order when we announced it a few weeks back, just previewing the likelihood of those stay-at-homes being extended, certainly in those two regions. As it relates to preparation, we've talked a lot about PPE and the 600 plus million units of procedure masks, surgical masks, as well as N95 masks that have been distributed. We've talked a lot about what's in our inventory, still over 500 million units of PPE specific to just face coverings and masks that are still in our inventory, just because it's important to remind folks the critical nature of ventilators as it relates to the issues associated with the scarcity of ICUs. We still are in possession of an ample supply of ventilators. You can see here over 20,000, not just in the state inventory, close to 14,000 vents, but also vents still available within our hospital system. Good news on Moderna. As of this moment, I can report to you, we'll update you on an hourly basis, or at least over the course of the next few hours. We'll update you at the end of the day, but as I speak, 21 of the 31 sites that we identified for Moderna to have vaccines delivered, and remember, we're working with McKesson to do the delivery. They are the intermediary working for Moderna in terms of the distribution of these doses of vaccines. That first phase has arrived in California, 110,000 doses of the 372,600, or 672,000, forgive me, 672,000 have already arrived. 110,000 of the 672,000 have arrived, 21 out of 31 sites as I speak. And the reason why is not only did they get emergency authorization from FDA, we also had our Western States Scientific Safety Review Work Group, a complement of 17 members, 6 from Nevada, Washington State, Oregon, 11 from the state of California. Again, similar to what they did with the Pfizer vaccine, they unanimously approved the safety and the efficacy of the Moderna vaccine. They did so over the weekend, formally announced it Sunday morning, put a letter that we received late Saturday night. So the Moderna vaccine has arrived, and that is indeed good news. 672,600 to be exact is what we anticipate receiving this week. The 110,000 we already have. As we've said many, many times, this is storage for this vaccine is much easier than the ultra cold storage of Pfizer. This is just cold storage, which is the equivalent of freezer storage for the Moderna vaccine. It's a 22-dose regimen. Like the Pfizer vaccine is a 2-dose regimen, 21 days Pfizer, 28 on the Moderna. And we, of course, are encouraged by the Moderna vaccine in relationship to the storage needs in terms of our distribution, in terms of our logistics. We're now able to get these shipments into rural parts of the state, into parts of the state that are more remote. And that is indeed encouraging. There's also some other advantages in terms of the doses in each vial and the total number that you have to order, 975 versus 100 Pfizer orders versus Moderna orders. If I've lost you, happy to clarify any of that in the Q&A, but nonetheless, just some advantages, not on safety and efficacy per se, but real advantages on logistics for the moment with the Moderna vaccine, which is indeed very, very encouraging. Pfizer, here's just the update, 560,625 doses have arrived in the state of California. We got that first dose of the doses all in, 327,600, all of that arrived last week in the state. And that 560 anticipates, for clarification purposes, the 233,025, the 233,000 that we anticipate arriving this week. They're already starting to arrive, which is good, and we'll update you as to the status of all of that remaining 233,000. As you know, it's 40% below what was originally anticipated. And I appreciate the clarification coming from the federal government, the Department of Defense, in terms of their logistics mistake and owning up to that. Again, no reason to have a closed fist in this moment. All of us need to be humble at this moment. Everyone's doing their best. And I still maintain this is an extraordinary, extraordinary accomplishment for this country, for our nation, for the world, that these vaccines are even going into people's arms, that they have arrived. And I want to compliment everybody who was part of Operation Warp Speed. They deserve credit. The administration deserves credit. President and the Vice President deserve credit for working hard over the course of the last number of months to get these vaccines out and to get them in these states. We are so often too quick to be judgmental. And while we were disappointed in not receiving 40% more of the Pfizer vaccine, we are still very pleased that 560,000 doses of vaccine will arrive in the state of California. And what we are told very clearly, and I have confidence in this based upon the conversations we've had over the weekend and including conversations that my staff had today, we're going to see a stable of the Pfizer vaccine come on a more consistent basis. We don't know the exact number yet, and when we do, we'll let you know right away, but we now have confidence in that cadence. And so for our planning purposes, that will allow us a little bit more constancy, a little bit more ability to phase in and distribute these vaccines on a protocol that was anticipated based upon the plans of our guidelines work group and our community advisory group. I'll talk about them in just a moment. But briefly, I want to just update you. The first week, we did vaccinate, or at least administer, the first dose of the vaccine to 70,258 individuals. 70,258 doses of vaccine were administered last week. We'll keep updating you. These numbers lag just a day or two. We want to make sure we get them, make sure they're accurate. So all those doses came in. Not all the doses were administered. And that's why, again, we are, I think, again, why we're being, I think, generous to the nature of this unprecedented distribution all across this country, and respectful of how hard everybody across the spectrum, federal, state, and local, are working to do justice to really meet this moment head on. As it relates to the upcoming meetings, and I was joking with my staff last night. I said, I feel like a full-time red carpet concierge for everyone that does have access to my direct email and my text messages asking about their aunt or uncle, about a friend or family member. When are they going to be in the queue? When do they get the opportunity to be vaccinated? And I remind them, as I'll remind you, including family, everybody that's calling, staff, everybody that calls, that we have a public process for vaccinations. We not only had that scientific safety review group, which we talked about, that's been doing a remarkable job working with the Western states, but this drafting guidelines work group and this community advisory group. The drafting guidelines work group has been busily working on Plan 1B. And this is for the universe above 3 million individuals that we broadly have identified for Plan 1A prioritization, those that are currently getting vaccinated. And those are healthcare workers that have direct interface and interaction with patients and others, as well as those in congregate facilities, skilled nursing facilities, assisted living facilities. That's the first phase of universe, about 3 million. The Plan 1B is the next phase. The guidelines working group has been working on that phase, populations as well as subpopulations for prioritization. And that includes teachers, includes food workers, it includes vulnerable seniors. CDC put out their version of the guidelines. We will come out with more prescriptive versions. And I just want to update you today, the drafting guidelines working group is meeting again. And then on the 23rd, and this is why I wanted to make you aware of this, between 2 and 4, the 60-member Community Advisory Committee will meet with the 16-member Drafting Guidelines Work Group. And they will work through details and nuances, asking all the questions that we're all asking about subpopulations. and exactly who within that next categorization of priorities are going to get the vaccines. That's a public meeting, 2 to 4 this week on December 23rd, and you can watch it. Go to covid19.ca.gov, covid19.ca.gov, and you can tune in real time. We want to be as transparent as possible. And by the way, these are the folks that are contacting me. I'm saying, here's what you need to tune in on. These are not political decisions we're making top down. These are decisions that the experts are making. This is a world-class group, this guidelines work group, 16 remarkable individuals that are putting their reputations on the line and really doing justice on the issue of inclusion and the issue of equity. And then this advisory committee truly, we believe, represents the diversity of the state of California, not just racial and ethnic, but also geographic diversity, to really think about those subpopulations that are so often left behind in any vaccine drive, any vaccine distribution plan, into making sure that we do justice to California for all Californians. True inclusion, true equity, not just rhetorical inclusion, rhetorical equity, that we deliver on this promise. Please tune in if you're interested to discuss or rather listen in on the discussion of Plan 1B. And we hope to get those guidelines up and formalized very, very shortly. But again, on the 23rd, you'll hear a lot more about that. As it relates to the conversation we're all having today, and we're certainly having with my staff, this is very encouraging news. The federal COVID relief bill now heading to the president, $900 billion. We can talk about the merits and demerits. Is it enough? Should it have been higher? Well, let's just talk about what it is for the purpose of planning. And so I put 3 slides together we'll present to you, and I'll just walk through very, very briefly. And I want to caution, we have initial estimates. And so anybody watching, I want you please to consider the asterisk that is on these next few slides. These are initial estimates. These are back of the envelope estimates, but I wanted to at least give people a sense of roughly what we anticipate here in California to be the benefits of the federal COVID relief. They are significant. We'll need to do more in the future, but nonetheless, they are significant. Most significant, it's money directly in your pocket. That's the $300 a week for the next 11 weeks for unemployment. That's $20 billion, we believe, that will come into the state of California over that 11-week period. $600 direct checks to help lower-income Californians. We anticipate an additional $17 billion to be infused into the state. We got some good language on CARES Act funding, the $15.3 billion that we received from the previous CARES Act. There was some limitations. There was a little bit of lack of flexibility. They addressed that, and that's very significant in terms of helping us guide the distributions of those remaining CARES Act dollars. $325 billion in small business relief. This is critical at this moment. Now, I'll remind you of the $500 million we put up in grants, the billions of dollars, so roughly $3 billion in sales tax float without fees or fines or any associated burdens to small businesses, which we provided, the $100 million in hiring tax credits that we've done for business. That's what the state's done. And my budget that's literally at the printer, the budget that we'll submit to the legislature to become the state's budget after we work with legislative leadership, will also have some very significant small business support. So this is in addition to all of that, but we need to scale the federal government, and $325 billion in small business relief coming from this package will be very, very helpful. $284 billion just in the PPP program, the Paycheck Protection Program, rental assistance. We were all waiting, bated breath, about the need to see something big and bold happen on rental assistance. I'm not sure this is as big and bold as we had hoped for, but it is nonetheless significant. Potentially $2 billion of the $25 billion in rental assistance will come to help Californians in need. That is very, very significant and important relief at this critical juncture. We're working with the legislature. We're working to see if we can extend beyond February 1st. It's a partnership. It's a collaborative. A lot of work was done to work to get the original moratorium extended to February 1st. If we're going to extend it We're going to continue to have to work in that same spirit of collaboration. We are in that process as we speak. That obviously can be complementary potentially. Any moratorium or eviction or forbearance, foreclosure, mortgages across board spectrum, not just rental, but also commercial. But this direct rental assistance, $2 billion potential infusion, California, can't happen too soon. Testing, tracing, tracking issues related to vaccine distribution, very significant. $69 billion for the country, $1.3 billion that we expect here in the state. That's going to help with all of our efforts, advertising, marketing, distribution, the planning, logistics, all of those issues. And we were operating under a scarce mindset. Now we can operate with a more abundant mindset. This is a very, very healthy infusion of support. $8 billion, 8.5, we anticipate to help us with K through 14, also with UC and CSU. I can tell you as a former UC, well, still on the UC Board of Regents, CSU Board of Trustees, spent 8 years Lieutenant Governor in those roles more formally, more actively. This is significant relief for CSU and UC, and very, very timely and helpful relief through our K through 14. That includes community college system. We'll be talking a lot more about how that allocation is distributed. But again, plus or minus, these are estimates, $8.5 billion will be infused to help those, our educational system here in the state. Childcare, got 4 kids myself. They're all here. If you hear them in the background in the other room, childcare, can't get people back to work unless we have childcare. We keep our care workers safe, keep them healthy, keep those cohorts that we've allowed in terms of the central workforce going. But this $1 billion we anticipate of the $10 billion nationally will be very, very timely and helpful as well. Broadband, we've talked a lot about broadband. We're going to be talking a lot more about it. Love the enthusiasm of the California legislature. I can assure you we share that enthusiasm. It's going to be a top agenda for our administration in January. It's reflected in a lot of strategies, legislative as well as budgetary strategies, also now reflected enthusiastically by the federal government. $7 billion may seem like a lot of money federally, not close to what it needs to be, but nonetheless, it's helpful and includes $3.2 billion for low-income families. So it's additive, it's complementary, it will help with our efforts, it will help with all the distance learning, all of the things on telework, everything we've been talking about, very encouraging. Transportation sector, $2 billion potential infusion into the state of California, $45 billion for the nation. And then the SNAP issues, the issues related to food scarcity, food security, food assistance, agricultural assistance, nutrition assistance, $26 billion in that space, $13 billion just on the SNAP benefits. Again, that cannot happen soon enough, particularly during these holidays when we highlight these issues. We've done some supplements in the last number of months. I want to thank the legislative leaders for their insistence on some supplemental supports to our food banks. $90 million recently on top of the money we put in the budget, over $100 million of additional resources. We've been monitoring the availability of those resources. We're going to be very mindful of what is needed as it relates to food distribution up and down the state, but this is indeed encouraging as well. So that's it broadly on the COVID relief. Let's talk a little bit more about two specific issues I want to just bring up before we close out and answer any questions. We've talked a lot, I think all of us are talking a lot about this new COVID strain that we're reading about out of the United Kingdom. And just full disclosure, we've been having conversations the last 48 hours with the airlines, having conversations with our stakeholders all up and down the state. We're looking, just preview, nothing landed yet. I say landed, emphasis, landed yet as it relates to new protocols that we are pursuing, potential quarantine protocols, a requirement of quarantine protocols for UK visitors. I hope the federal government takes action in this space. They should. We've seen Canada, we've seen so many other jurisdictions around the world that have. In the absence of that, we'll be pursuing different strategies on testing and quarantine, and those have been activated in terms of those conversations. And as soon as I have more information, I'll share that information with you. But I wanted to share this information. It's just important that folks know this. we have a genomics sequencing effort that exists and persists on a daily basis in the state. We test anywhere from 5 to 10,000 samples every single day for mutations, for modifications in terms of the genomic sequencing. We do that in partnership, just as an example, in Northern California with CZU BioHub, which is in partnership. That's Chan Zuckerberg and UCSF. So upwards of 10,000 samples. We haven't seen anything related to a new strain yet, and that's constant monitoring. That is very active, very proactive in terms of the genomic space here in the state of California. So no evidence of this strain yet into the state of California. We've seen reports in other parts of the globe, South Africa, obviously some European nations, but we are not seeing that here. But it underpins and just underscores the importance of our continued surveillance and these incredible partnerships that we have. And in a moment, I'm going to ask Dr. Galley to talk a little bit more about this space in particular. But first, I just wanted to update you on the California Notify app, which is, again, just another tool in the toolkit. It doesn't supplant, doesn't substitute, it's just additive. But 7.35 million people have activated this new opt-in technology. And I remind you, if you're willing, able, desirous to get this notification app, completely private, opt-in, don't have to do it, but almost 7.5 million people have already. You can go to the Google Android platform and you can just download under Google Play their app, or you can just go on your iPhone and simple open of the settings, and you just go to the exposure notification section in the settings, and you can activate this. I did this right away, one of those 7.35 million Californians doing this. The more people that do it, the more effective this notification tool will become. And so I hope you'll consider doing that. Very encouraged by the 7+ million that already have, and I hope you'll consider the same. California Notify, go to Android and go to Google Play, and you can download the app. You can pull it down as well on your iPhone, the iOS platform. With that, let me just turn this platform over to Dr. Galley. And Dr. Galley, if you could, just briefly, because we've been talking a lot over the weekend, you and I are talking, the team today, about this UK strain and what you're seeing, what we're not seeing. Give us a sense of where you think that's going, what it means in terms of virulence, and what it means to everybody watching, and why we should be concerned about it, why, though you're not yet alarmed by it, but nonetheless, we are monitoring things very, very closely. Doctor?
Yeah, thank you, Governor, and good afternoon. So indeed, as you said, the concern over the past many days is this new strain of COVID. Let me be a little bit more specific. We know that viruses, especially new viruses, are always prone to mutations, meaning that its genetic code changes a little bit. And sometimes those changes are not, have no impact. And other times the change is material and important. And this is a change that was noticed over the past many weeks in the UK, also in South Africa, and seen in a few other countries in Europe, where essentially the COVID virus that we're finding in some individuals who test positive, the way I like to think of it is it's a little bit more sticky than the COVID virus that we've been seeing to date. And what I mean by that is we know that for COVID to enter a human cell, it needs to bind to a receptor, a sort of front door on a human cell. And the new mutated COVID virus seems to bind a little tighter, a little more easily, and enter the cell of the human body easier than our current COVID virus that we have here, primarily in California and the United States. So what does that mean exactly? It means that an exposure to somebody with the new strain may mean you're more likely to get infected than if you were exposed to the current strain. And that is why we're worried. We haven't yet seen what we call increased virulence, meaning that people necessarily get sicker with this new strain, but the fact that it infects more easily, it seems, is what we are worried about. So because of this, we're of course working with our partners across the state, across the nation, to do exactly what the governor said, make sure that if we do see it here in California, that we're able to react to it very quickly. If we see it in the other parts of the nation, that we're similarly able to react. We do, on a daily basis over the course of a month, check thousands of specimens to see if the genetic code of the virus is changing at all. So we are watching closely for this specific mutation. And there's a lot of reasons why we're concerned. A bit I've already addressed, but frankly, we're concerned because of the unknowns. We're concerned that we aren't sure how this impacts the broad scale efforts to contain and mitigate the virus as it exists now. And so that is why we're looking to make some recommendations at further monitoring people who travel in from these impacted areas, particularly the UK, and having those conversations now. Because the last thing we want to do is let a new strain of COVID come and spread more rapidly or easily across the state. We've done it before, we've mitigated the virus in the past, and we would need to do that and do that early with this new strain. So we're watching this very closely, and we'll be keeping everyone updated as our plans and decisions move forward.
For that update, of course, happy to answer any additional questions about that in a moment. By the way, just a moment ago, we just got more information about Pfizer now, 50 locations where the next the tranche of that vaccine, 233,000 doses, have now arrived in the States. So all this happening in real time. We'll update you as often as we possibly can in terms of the real-time distribution of the vaccines, but encouraging to see now Moderna vaccine, not just the Pfizer vaccine, available across the state of California. Moderna now getting into parts of the state where Pfizer was not yet distributed, and encouraging news coming from Moderna and Pfizer as it relates to the expectations over the next number of weeks in terms of doses coming in a more consistent more consistent basis. So with that, of course, we're now happy to answer any questions.
Hi, Governor. Thank you. Early during the pandemic, a lot of the authority for making decisions rested with county public health departments. And when it came to testing, there were really spotty, a real patchwork response. If you could get a test based on what part of California you were in, there was a lot of disparate authority. I know you're coming up with guidelines right now on vaccines, but we're already seeing some counties making their own decisions. Are you worried at all that any kind of fractured authority here on vaccines will replicate some of the problems we saw with testing when it came to equitable allocation, standards statewide for who can get a vaccine?
Yeah, and forgive me and forgive all of us with this new technology, and you were breaking up a little bit, Dr. Galley. Hopefully you heard a little bit more about that, but I believe the question was around localism and making sure that we're monitoring in terms of the safety, and not just safety, but the directives that our guidelines working group has put out in terms of our expectation, in terms of the prioritization of subpopulations and holding folks accountable, providers in our network of health professionals accountable to making sure that these priorities are being met in those that are being directed from the state. And Dr. Galley, that is indeed the case, and maybe heard more clearly the question. Perhaps you can talk a little bit more, because we've exchanged some memos around the issue of enforcing those rules and regulations, including, dare I say, making sure that doctors are living up to the Hippocratic Oath as it relates to making sure no one's cutting in the line, particularly well-known individuals or well-resourced individuals in the state as well. Doctor?
Yes, Governor, and just to underscore, the fundamental platform that California's vaccine distribution plan is based on is prioritization based on risk factors and making sure that it's an equitable distribution across the state. And as you know, our priority group 1A, which we are actively working, all of the doses that the governor's mentioning of both Pfizer and Moderna are tracking to be provided to that priority group 1A. That includes our frontline healthcare workers and our residents of long-term care facilities. I'll remind you that in group 1A, priority group 1A, we have 3 tiers. Those tiers are in order, tier 1, 2, and 3. And certain healthcare professionals who are on the front lines are in tier 1 and others are in tier 3. And we expect and are watching closely that our counties and those who are receiving the vaccine stick by those priority groups and that tiering system. It's all there to make sure that based on risk and prioritization that people do get the vaccine in the order that the state and all of these different groups coming together have decided makes sense in California. We are working to make sure that we're able to track this. Part of the effort on understanding not just how many doses are being administered, but where those doses are being administered, and tracking that through our various IT systems as part of our strategy, but then also working with the various bodies that work to enforce clinical practice, individual practice, making sure that we are watching closely so that if there are any flagrant ignoring our prioritization, that we can act swiftly so that those who should be receiving the vaccine now are able to, that the supply is sufficient based on our plans, and that those who are just eager to get it and look to either innocently or not so innocently cut the line, that we're able to monitor that and make some enforcement action. So we as the state are working on what those look like, talking through with not just our local county partners, but also the various groups that ensure that whether it's physicians or hospitals or other clinical settings that are up first to distribute, that we're able to communicate with them very clearly on not just these prioritizations, but how we expect to monitor and watch that they are indeed adhered to. If there are cases where we are worried about that, somebody is doing this out of order, that we will reach out to those community and county partners that have agreed to follow this prioritization, and if follow-up action is necessary, we will take it swiftly.
And I should just note, we have a well-established IT backbone end-to-end system that comes, not surprisingly, we've had for some time related to the 19 million flu vaccines that we distribute on an annual basis. And that's typically done over 60, 90, maybe 100-day period, each and every year in a concentrated and focused way. So we are able to monitor in a very formal way. Here's something, though, I just, in the purposes of maybe over answering the question in the legitimate query, it's important to note that we have our populations in priority, Plan 1A. And as Dr. Galley said, we talk about those 3 tiers. And within those tiers, there's subpopulations. But when it gets to, for example, I was at UC Davis, when it gets literally to the hospital site, there is some autonomy at that level. And that autonomy would include, as a specific example, if you're going to take care of the ICU staff, that staff would include environmental service workers. It would include their support staff, their direct contact staff. Now, that may not be obvious when you're looking at the tiers, that a janitor or someone that's essential to the operations of an ICU is also part of that priority. So we have some flexibility there, allowing folks that autonomy to make judgment calls. So we're not prescribing in total nuanced terms, but we are, in terms of broad equity terms, and terms that are well described by our guidelines working group.
AP.
Hi, Governor. This is a multi-part question, so just bear with me. The growth model that you referenced last week now is projecting 99,000 hospitalizations by mid-January, which is nearly 6 times the current level. Do you think that's a real possibility, and how could the state system absorb that many patients? And then beyond that, is the state going to establish protocols for rationing of care, or will that happen county by county? And do you think we're close to instituting such drastic measures?
No, I appreciate the questions, and I can assure you we've been answering those questions, including over the weekend. And I should note, one of the things that was missing from the federal request slide that I put up was a request for another field medical station, a full medical station that is inclusive of staff as well. So look, we are anticipating a substantial increase in the hospital surge. You're correct. Some of the modeling suggests in that 90,000+ range. We are working with the hospitals, the hospital system, working with their representatives in a very granular level, not just at the state level. And we are looking to support the staffing in these alternative care sites and looking to potentially stand up more alternative care sites up and down the state. But let me turn this over now to Dr. Galley, can talk more specifically about when we do anticipate not just the ICU going into the surge, which, as you know, 2 of our counties already have, or regions that is, but now hospitals moving into their surge plans and their surge capacity.
Yeah, Governor, and thank you for the question. I mean, indeed, and this has been certainly part of the reason, even before we see the hospitals have such an extreme number of patients, that we've been signaling to all of you, really working not just with our county leaders, but individual hospitals on what we see coming based on our projections. Simply put, and to remind people, we believe that 12% of today's cases will be hospitalized 12 days from now, and then 12% of those hospitalized patients will be admitted to the ICU for critical.
Looks like my tackle box you got there. So my bag just broke. I have a new one that's coming in the mail, but every one of these is something adventure.
Certain regions do exceed their existing capacity, and even may go beyond the existing surge capacity that they currently have planned. That is why, in part, we work closely with those hospitals to talk about not just the theoretical, but boots on the ground, what's actually happening, meetings frequently throughout the day to make sure that we're able to do as much as we can to support each facility as we sort of day over day increase that need for that level of care. It is true that some counties or some regions may begin to exceed their existing stated hospital capacity, not just ICU capacity, by the end of the month and early in January. We don't see that across the entire state quite at that time, but we're watching it very closely. Remember, we have a well-exercised mutual aid system between counties, between regions, that we will always invoke and work to make sure people who are in one facility or one part of the state and they're not able to get the level of care that we need them to get in a timely way, that we work across the entirety of California's healthcare system, and we will continue to do that. With regards to your question about care rationing, California, from the beginning of this pandemic, worked with stakeholders, not just in the healthcare delivery system, but throughout, with groups of advocates for seniors, those with disabilities, a number of different groups across the state to create what we call our crisis standards of care guidelines. These are guidelines that are posted on the CDPH website that explain exactly the process by which facilities, happens locally at the hospital level, happens regionally between healthcare delivery systems in a certain geography, and every hospital should be prepared. I know some have, in an abundance of caution and to be well prepared, begun to have conversations about how they stand up their crisis care teams, those who are in a hospital that are able to help support the bedside clinical team to make what are challenging decisions. But we continue to build up our capacity so that even though hospital systems may be preparing along those lines, that we do everything we can to make sure Californians receive the care that they want. So our goal is to make sure those plans are in place, but work hard to make sure no one has to put them into place anywhere in California.
And I should just note on the crisis standards of care, that was a process that unfolded over at the beginning of this pandemic in anticipation of a moment like this. So we worked through, there were some bumps in the road in terms of just people's reaction. When the draft was originally submitted, we listened to those concerns, we incorporated and amended those standards, and we now have them distributed. That said, we also, over the course of the last many months, have been preparing for a significant surge as it relates to looking at footprints at existing hospital sites, looking at the capacity to expand those existing footprints, not just alternative care sites, but looking at expanding the healthcare delivery system within the system itself. Clearly, that's already taking shape and place in many parts of the state. But I remind you, the issue at hand for us, the primary issue today, and likely for the upcoming future, at least in the immediate future, I should say, is staffing. And that's why we're being particularly aggressive in terms of the federal asks, aggressive in terms of our promotion of the Health Corps program. And I'll remind folks that know someone, or maybe they themselves have recently retired or have a particular expertise they can offer, to go to the COVID-19.ca.gov website to learn about whether or not they are needed to help support fellow Californians at this remarkable time of need. That program has been effective. We just need to scale it back up, and we need to remind people of its purpose and its potency. Final point, because it's relevant, and it's a question I've received often, and that is, are we pursuing the USNS Mercy again? As you recall, we were the beneficiary of one of the large medical ships, East Coast and West Coast. Currently, we are not. What we, however, are looking for is personnel, folks that are those that often are deployed on the USNS would be identified as a top priority staffing our need, not the physical structure yet, as it relates to our immediate needs.
Justin Gardner, SF Chronicle.
Thank you, Governor. With respect to the regions at 0% ICU capacity, are those regions still transferring patients to other areas of the state that have more capacity? We've heard from some Bay Area counties that they are no longer accepting transfers because they're concerned they might need their beds for their own counties. What can you provide on that update?
No, it's a great question. Of course, we've seen that in the past. You saw from Imperial folks coming up the Bay Area to decompress that system a number of months back. But as it relates to how we've organized these broader regions, we've done so intentionally. And with that, let me ask the person that architected that strategy to answer the question with more nuance and specificity. Doctor?
Yes, we continue to work to ensure that patients who do need to be transferred, we do our best to make sure that those transfers happen in a timely way. As the governor appropriately pointed out, the number one strategy is to work to increase the staff, the supplies, and the space in the existing hospitals where patients are now, because we know that over time, as not just one or two areas of the state get deeply impacted with COVID, and those regions see their own ICU capacity go down quite a bit, that we will not be able to as easily move patients from one region to another. You'll recall, as the governor reminded us, that in the summer, we did move patients from Imperial through Imperial County throughout the state. Today, that is more challenging, because those hospitals that had room to accept those patients from Imperial today have their own surge challenges. So again, number one strategy is to support hospitals where the patients are today, to make sure either through expansions on the hospital footprints themselves, or through alternative care sites, or transferring not across the entire state, but maybe to nearby counties where they have some of those alternative care sites set up as well. So we are seeking to do that. Even if a county is said one day that they're not able to take a transfer, we constantly check in, because we try, as every hospital does, every county does, every region does, to make sure we do all we can for every single patient within the state. And I would be negligent to not point out that in the prior question, when we looked forward to the forecasts of quite a few patients in our hospitals down the road in January, towards the end of January, that we should remind you that that is not a story that is already written. Some of it is about cases that have already happened, but our actions today can make a difference on what happens down the road. Every bit of our ability to not mix, keep our face covering on, reduce the likelihood that we either transmit COVID or ourselves are infected by someone else transmitting it to us, that becomes a victory for the state. That becomes a role in protecting our healthcare delivery system, so that the points we're talking about today, whether it's about transferring patients across the state or moving into crisis care standards, that all of those things can be avoided if we together work to follow those simple acts and do what we can, especially as we enter into the next couple of weeks with important holidays for our state and nation, that we can still make a contribution, a gift, if you will, to the entire state by avoiding mixing and avoiding extra transmission that does protect our hospital systems.
I appreciate Dr. Galley reminding all of us that we have agency, that we're not victims of fate. And I say this often, I'll repeat it. The future is not just something to experience, it's something to manifest. Decisions, at the end of the day, our decisions, individual decisions, the sum total, the collective decision-making of 40 million Californians strong will determine that fate and future. And so it is really important to take heed this moment we're in so many ways reflected of the surge that we're experiencing coming from that Thanksgiving holiday. Now, as we move into this week in Christmas and New Year's, it is incumbent upon all of us to just consider in contemporary terms the experience that we are reflecting today and how that experience was manifested a few weeks back by decisions where we were seeing activity and movement that ultimately inured to putting this kind of pressure on our ICUs and hospitals. We can avoid that in the next week, the next days, and we could substantially impact those projections, bend that curve, and work quickly, get this third wave behind us, and get out of this in a way that I think this state is uniquely capable of.
Ryan Carter, LA Daily News.
Thank you, Governor and Dr. Daly, for the update today. Maybe a slight tangent here from such sobering. I'm calling from Pasadena, where obviously the Rose Bowl, obviously a huge deal. Can you elaborate a little bit more on the state's position as it relates to the 2021 Rose Bowl game? Perhaps talking a bit on why it was important to push back against these efforts to make an exemption for player guests, and perhaps elaborating a bit on just your general reaction to the game relocating to Texas this year or next year.
We love the Rose Bowl. It's part of, it's I don't know how best to describe it. As a fifth generation California, I feel like, there was a gold rush and then there was a Rose Bowl. And so it's been a big part of our lives, the Rose Bowl parade, the game itself. I'm an avid sports fan, so I'm eager to watch the Rose Bowl. That said, look, I think the question in so many respects, and I appreciate the tone and tenor, the way you even asked it, answers itself, right? I mean, when you're in Southern California, you're 0% ICU capacity. We can't make exceptions. We have to be stringent in terms of our rules and our regulations. We've got to do everything in our power to mitigate spread and to mitigate mixing. And so what they asked for was contrary to that determination and to our medium and long-term goals. And so obviously, I'm disappointed. We're disappointed that we had to make that call. But boy, hear me loudly. Our reverence, our respect, our admiration, our pride that comes from the Rose Bowl, and obviously the impact it's had on Pasadena and the entire region, the international identity that we receive every year from it, the economic vibrancy that comes out of it, the brand, I mean, everything about it. And so just know that none of this is what we want to do. It's what we have to do in order to mitigate the spread and be responsible at this moment at peril of regretting the decision and putting people's lives, 233 people dying on average every single day, putting people's lives at risk.
John Myers, LA Times.
Thank you, Governor. You earlier in this event hinted that the stay-at-home orders will probably be extended beyond the current times in the various regions. How's that going to roll out in terms of how people are going to know when that happens and how long the length of that is? That may be something you want Dr. Ghali to talk about. And then quickly, just because you referenced it at the top, but I don't think the rest of the public understands, you are in quarantine right now. Can you talk about what exposure you have to staff and the rules that you have around staff? Do they all wear masks around you, and what that procedure is, given that you are back in quarantine?
Yeah, everybody wears masks. We have very strict guidelines, rules, procedures, temperature checks. People are being tested all the time. Most folks are teleworking. So this seems deeply anomalous. Just shows the virulence of this disease, shows how easily transmittable this disease is. And so very few people in the staff environment. We were, the only contact we've had was in preparation for some of the events that we're doing right now in terms of just trying to communicate with you, trying to be accessible to you, trying to be transparent to you. In some cases, there are a few extra people in the room, but everybody wearing masks up until literally when you see us take them off to communicate with you and others. So it's unfortunate, and we wish speedy recovery for the individual that tested positive. That was proximate to me a number of days ago. I think it was Friday to be exact. I was tested yesterday, tested negative, but you got to walk your talk in terms of protocols that we put out, established as relates to quarantine, which we did, and that 14-day quarantine a few weeks back, and now with 10-day quarantine. Look, as it relates to the issue of next statements, or rather when we will be making announcements based upon trends, based upon these guidances that we put out that expire on the 28th of this month and the 30th of this month. I appreciate, John, you referencing Dr. Ghali in the context of being able to more specifically answer that, and I'll turn it over to Dr. Ghali, who will do just that in a moment.
Yeah, John, thanks for the question. And indeed, we are preparing over this week to really roll out exactly how those determinations will happen. We expect to run this, whether it's at the end of this upcoming weekend or early next week, indeed, for that first region, so that we can anticipate. And I'll remind you what we said. We'll be looking at ICU capacity projections 4 weeks after we have the first day when that regional stay-at-home order could be lifted. So if you're looking at the 28th of December, you're looking somewhere around what our ICU projections are about the 25th of January. So we have tools, as we have in so many areas, to make these projections. What will we be looking at? We'll be looking at current ICU capacity. We'll be looking at the number of new cases on average over a 7-day period. And we'll be looking at that sort of transmission rate factor, not just what the transmission rate is, but how fast is it either accelerating or decelerating. So those different aspects will come together to help us make that projection. And so it's not just, well, what is my ICU number in my region today? It's actually a lot about the various individual decisions and behaviors that have manifested in the case number and that are effective value that some of you have been tracking with us since the beginning. We'll be looking at all of that, bringing it together, socializing it with many so that they can track it on a very regular basis, starting early next week, sharing that about San Joaquin Valley, and then quickly after that, the Southern California region. And as the governor said, given where we are today, and we, of course, only will reveal this when we are done with the calculations at the time that they need to be done. But at the moment, our projections don't show that any of the regions that could first exit the regional stay-at-home order will likely do that. But as they say, we will only make that call when we actually do the calculations when the time is right.
Final question, Brittany Johnson, KCRA.
Thank you for the question. Two questions here. One, Governor, what would be your takeaway to businesses and everyone now that you've had quarantined twice within a month? And does it change your outlook on any future decisions surrounding COVID? And the second question here, are you quarantining with your family? Are you separate from your family? And how is this going to affect your holiday? Are you guys going to have to stay in California? Are you going on vacation to quarantine?
Yeah, no vacations. That ended in mid-February. No weekends either, but that's an aside. No, I'm separate from the family. We have a separate little small room that they've put me in, and so I'll be here for the next number of days, and hopefully we'll keep getting tested negative, and that should calm the nerves of my wife and my 4 kids. But we hope to be doing our best, like everybody else, to safely stay at home and enjoy what we can of the holidays. I'll be working, but my family will try to create conditions where this can be as normal as it possibly can for your family, for my family, for all our families. Look, these quarantines aren't easy on anybody, and we're mindful of that. That's why we did a lot of things over the course of the last number of months on providing people presumption so that they're eligible for resources if indeed they have come into contact with someone that tested positive, so they can do so safely and can afford to do so as well, that they have economic supports and they have the ability to be isolated and get the opportunity to be separated for a period of time if they must from their family and have the resource. So there have been a lot of tenets of support in that space, but I cannot impress upon you more the importance of doing a lot more in scaling those efforts. That's why I was very encouraged to see what is coming from the new stimulus. And while it's lower number than we had hoped for, it is nonetheless significant. Let me just say this, because I didn't say this. Thank you, Nancy Pelosi. Thank you, Speaker Pelosi, for not taking not only her eye off the ball, but not taking foot off the pedal in terms of accelerating a responsible conclusion to these very, very exhausting negotiations over the course of many, many months. I just want to, make the case not just for what was accomplished, but for what she, in particular, accomplished with this new stimulus and how impactful it's going to be to people directly all up and down the state. Let me just close by reminding people that what comes from the federal government does not end the story. It's the beginning of the story of support, including the small business supports and medium-sized business supports, rental assistance, eviction assistance, all of that, which we are responsible for as well as a nation state, at least a state as large as ours. And so you'll be hearing a lot more about that in the coming weeks. We have outstanding legislative leadership that is very focused on this, very committed to this, and we are working overtime to see if we can advance some early decisions and make some pointed movement, so we're not waiting months and months and months for the traditional legislative cycle, meaning we hope to take some early action, long-winded way of saying some early action on all of these fronts. We will update you in the next hours and days on issues related to the UK. We'll continue to update you on vaccination plans. We'll update you as well on any news we hear from the federal government in terms of additional supportive staff from the Department of Defense, from HHS. I want to thank HHS for providing additional supports for the monoclonal trials and the infusions, which we'll be doing very shortly when those resources arrive. I want to thank the team at Department of Public Health and all of those in the Scientific Safety Review Committee, the vaccine distribution planning and the work groups for their diligence. I encourage people to tune in on the 23rd, a couple days, to see where that progress is on the Plan 1B. I thank, again, all of those that are responsible for Operation Warp Speed. It's just wrong that we don't say this enough. It's an extraordinary accomplishment that we're even in this position to have the ability to get doses of vaccines in people's arms. And I cannot impress upon people enough our gratitude, my gratitude on behalf of the state for the millions of people that will benefit because of the urgency and the deliberative speed that was advanced, that has been advanced through Operation Warp Speed. With that, look forward to updating you tomorrow, updating you Wednesday, and hopefully doing the same. May spare you on Christmas Friday as well. Take care, everybody.